So Bhanumati has asked me this question. She says she's a fitness freak and she's delivered a baby 3 months ago, and she wants to get back to fitness, and if getting back to fitness will affect her milk supply. So to answer this question, it really depends on what kind of delivery you have had, whether it's a vaginal delivery or a C-section. So ideally, you need to get a letter from the doctor saying that you are fit to get back to any sort of exercise, and generally it's about 6 weeks for a vaginal delivery if everything is okay, especially if you've had an episiotomy and if your stitches are have well healed. And for C-section, we generally recommend any time between 8 weeks to 12 weeks, again depending on the scar and whether that is completely healed. So that is a timeline where you can actually get back to fitness, and if whether getting back to fitness or any sort of exercise affects milk supply, it actually helps you to get more milk supply, because you tend to drink a lot of water, which is number one thing when you actually breastfeeding. You keep drinking a lot of water, you have nutritious food, and you keep yourself hydrated all the time, which is also what you will do when you are exercising. So if you are somebody who eats before exercising, continue doing that. So basically get back to it very slowly, don't jump into it pretty quickly. Start off with normal walking exercises, any pelvic exercises that your physiotherapist or doctor has recommended, and then ease into fitness rather than directly going on to lifting heavy weights or doing high intensity interval training or anything like that. So yeah. Pavitra is asked if are there any particular exercises that will help her get back into hardcore fitness. So what happens during pregnancy is the muscles in your pelvic floor are undergoing a lot of changes to help you deliver the baby, right? So the number one priority for us is to strengthen the muscles in the pelvic floor. And this can happen through a lot of exercises, one of which is the connection breath, which is basically a small breathing exercise where you breathe in, expand your stomach, stay there for a few seconds and breathe out. So this can be done as soon as you wake up or any part of the day to establish what is known as a connection breath, and this can be used throughout your exercise regimen as well. The other exercises that you would have done during your pregnancy is like the Kegels, that will help you strengthen the muscles, all the muscles in your pelvic floor, clamshells, etc. So these are exercises that you can start off with before you actually get back into hardcore exercising. You can also do normal walking. You can go for a 30-minute walk followed by a jog, and then you can progress that to running. And also when you're getting back into weight training, try and lift. Start off with minimal liftings. Don't start off from where you actually left. You will not be able to do that in the first place. Start off with very minimal lifting. Get back all your strengthen your muscles. Smita is asked how long does she have to wait before she gets back to fitness after delivery. This really depends on what delivery you've had, whether it's a vaginal delivery or a C-section. So if for vaginal delivery, if you've had an episiotomy and if the stitches have healed, then anywhere between 4 to 6 weeks you can start getting into slow movement such as walking and so on before you get back into the general fitness, going to the gym and lifting weights. But if you've had a cesarean, then we would recommend that you wait for at least 8 weeks for the scar to be completely healed. So anywhere between 8 to 12 weeks is what we would recommend to get back into fitness after a C-section. But for both of these, it is generally advisable to get your gynecologist's approval before you do any sort of exercise, because we will not know what other complications or what other issues that you may have. So this is basically a general rule of thumb. Shweta Nayak, so she wants to get back into HIIT and wants to understand if there are any pointers to help her do so. HIIT is a high intensity interval training form of exercise, and it requires a lot of energy for you to accomplish that. So if you've somebody who's done that before and you know how it operates, then I would recommend for you to get back into it slowly. So for example, if you've done 45 minutes of HIIT, start off with 20 minutes and then ease your way into it. Before that, prepare yourself to get back into fitness, such as all these pelvic floor exercises, connection breaths, Kegels, exercises that will strengthen your muscles in the pelvic floor, walking. So try and get back into minimal form of exercise before you actually hit any form of HIIT. And always remember that HIIT being very intensive, you will always have to hydrate yourself, have protein rich nutritious meals throughout the day. That will also help you with breastfeeding, because what you'll have to remember is when you're breastfeeding, you do not want to dehydrate yourself. So hydrating yourself throughout, and especially during the workout sessions, is very, very essential. Suhana has asked if there are any benefits to exercise, especially during breastfeeding, because breastfeeding consumes a lot of additional calories anyways. So number one, breastfeeding need not consume a lot of additional calories. Anywhere in the range of 300 to 500 calories should suffice if you're exclusively breastfeeding. And this is another reason why you should start exercising, because it will help you to drink a lot of water to keep yourself hydrated, which eventually increases your milk supply as well. And also when you exercise, you tend to feel hunger, you eat proteinaceous healthy meals, which again is going to help you with your milk supply. Apart from that, exercise will help you to get some time off from the baby, especially if you've been breastfeeding throughout the day. For newborns, it will get some time, your free time, where you can do what you want and relax.